Are you a woman standing at a crossroads, eager for change? It's time to connect with your authentic and empowered self at Boss Leap. Join Dr. Sylvia Morris and Dr. Angela Walker in this empowering community where real-life stories of courageous and talented women inspire and motivate. Engage in honest conversations that foster well-being, drawing from our own journeys. Let us guide you toward profound growth and transformation in both your personal and professional life. Here are your hosts, Dr. Sylvia Morris and Dr. Angela Walker.
Welcome to Boss Leap. My name is Dr. Sylvia Morris, and I am here with my co-host, Dr. Angela Walker. Today, we have the privilege of talking to Dr. Andrea Willis, and we learned so many things about Dr. Willis, how she went from pig farmer to pediatrician, what her North Star is, and how medicine and ministry augment each other. So we are going to get into our conversation with Dr. Andrea Willis.
So, Sylvia, before we get into Andrea's interview, I wanted to ask you, because she brought up such a beautiful lyric from one of my favorite artists, Donny Hathaway. I was so embarrassed I couldn't remember whose song it was from, but basically her words, and it probably will flub it, but said that if my words don't come together, listen to the melody. Listen to my melody is what she said. And just curious, listen to my melody. I think it's, number one, it's just such a beautiful song, and all of his songs, his lyrics are just amazing. What does that mean to you? I thought that was a good topic for today.
Yeah, I missed the Donny Hathaway reference. And then when you said it, I was like, yeah, that is Donny Hathaway, A Song for You.
Yes.
I think of it mainly as listening to my heart and really going with the thing that calls me, how spirit is calling me and moving me forward to do the thing that I was explicitly put on earth for. And certainly in this iteration of life, I'm supposed to be doing what I'm supposed to be doing. So yes, I am a physician, and we're a podcaster and all the other hats that I wear, niece, friend, all of those things. But am I doing what my heart calls me to do? And am I living and walking in my purpose? And what does a song, listening to your own melody, mean to you?
I think just some of the lyrics that come back for me in that song is he says, I've been so many places in my life and time, sung a lot of songs, made some bad rhymes, which he did. But some of that just informs your melody of life. I think for me, yes, I don't always have the right words to say, but if you watch how I move and can see what my intent is, I think you overall will know that I mean for you to, or I mean to impart wisdom, knowledge, kindness into this world, and definitely in what we're doing now and what I'm, even doing in my career, wanting to impart more of that for women in general. Just the power of walking, as you said, in your calling, and listening to your own melody. And everybody has their own song to sing, and trying to remember not to try to sing someone else's, but to do my own thing. Because I think another thing that she mentions, and I don't want to give away too many things, is there can be a first for everything. So you may be trying to follow someone else's path, but your path might be the first one that is uniquely designed, for you, but still may have, a broad purpose like someone else beside you, but, follow your own melody. Yeah. So I think that's what that means to me. So
I love it.
without further ado, we will give you some more insight into what we're rambling on about because she did actually put all the words together and her melody was beautiful. So without further ado, we're going to introduce one of actually our Georgetown former classmates and current rock star in the field of medicine, pediatrics, an actual CMO, and just really a trailblazer for women in the C-suites of medicine, Dr. Andrea Willis.
Welcome back to Boss Sleep. I'm here with my co-host, Dr. Angela Walker, and I'm Dr. Sylvia Morris. And we are talking today to Dr. Andrea Willis. We're just going to go ahead and get started. So, Andrea, where did you grow up and what did you want to be when you grew up?
Well, thank you, first of all, for having me today. It is such an honor to be with you. And I have to say this, you ladies were a year ahead of me in medical school, and we looked up to you. You just don't understand how much we looked up to you, and you're still sheroes to me today. So I do want to say that, like, you deserve flowers big time. So I don't want to miss this opportunity to say that. But I grew up in Athens, Alabama. I grew up helping to
Athens,
raise
I'm sorry. I know Birmingham, Montgomery, Selma, Mobile. Where's Athens?
Athens is near Huntsville. I mean, it's
Okay.
really
Okay.
right down the street from Huntsville.
Okay.
So
So,
That's a beautiful
Florence,
area.
Alabama.
yes, so it's like Huntsville, Athens, Florence. It's in between Huntsville and Florence.
So I have been there then. I passed your town. Who knew? Okay.
See, there you go. And it's growing. It is growing. But I grew up there. And even though I lived in the city limits, my grandfather was able to raise pigs in the city limits because they rezoned it after he'd already established his pig farm. So I grew up in Athens, Alabama, hoping to raise pigs.
Really?
Yes, yes.
Wow.
And
That's a story.
I love starting the story there because it really contributed to my work ethic. So when I was little, my grandfather had a massive stroke and he was basically paralyzed on the left side of his body. But he refused to give up his pig farming, so he decided his grandchildren would be his arms and legs. And I mean, he worked us like men. And I was the only girl at that. So, I mean, I can pig farm with the best of them. So, I do
Wow.
love telling that just because, like I said, it definitely started a work ethic, but I even knew back then that I wanted to be a doctor. And I remember my grandfather saying, "You are going to be a great doctor." I mean, it was in the midst a lot of times of us doing the pig farming that he would say that. I didn't know where it came from, but I knew it back then. But even as I was growing up there, I remember there was a shed in the back of my grandparents' house, and I heard this mama cat just in all kinds of distress, and I didn't know what was going on, but I went in the house, I got some dishwashing gloves, I got some scissors. I didn't know what I was gonna do, but I was gonna help that mama cat. So I got those things, I went out there. Thank goodness for the cat. It only took massaging the belly a little bit, and she had one kitten. So that was my first patient,
Oh my
and
gosh.
I knew I
Your
was gonna
first
be a
delivery.
doctor. My first delivery. I actually thought I was gonna be a OBGYN because of it.
Yeah.
That changed, but still, my first patient.
Oh, that is incredible. What a story. Okay, so you're our first podcast guest that grew up on a pig farm and actually worked that pig farm. But yeah, the work ethic, we hear a lot of that in terms of how people have grown up. That's a beautiful story. And again, I'll have to add that I just, the recurring theme that I hear amongst women that have done, really great things in their life, if someone in their life spoke that power that you're going to be great at this or you can do this. And I think that just has tremendous meaning. So thank you for sharing that. And thank you again for the flowers.
Yeah.
I love to give flowers when they're due, and that means the world to me, knowing who you are and what you have done for the world of medicine. So I truly appreciate that. And along those lines, at Georgetown, can you tell us what the Georgetown experience meant to you? What was it like for you?
Oh, it was everything. It still is everything. I just remember the very first time I went to Georgetown, actually, I just happened to be in DC, going around to the different medical schools, picking up applications. And when I went to Georgetown, I remember meeting Joy and Dr. Hoyt.
Wow.
And there was something about it where it was welcoming. They introduced me to other folks as well. Everybody was so nice and so welcoming, and with Joy and Dr. Hoyt, you almost got, "This can be home,
Mm.
but don't think you're gonna just come here and not earn your keep." It was
Mhm.
that kind of, "We're happy to see you, but if you come here, just know you're gonna work, you're gonna be good here,"
Mm.
So I did appreciate that, but when I came back for my interview, I do remember standing on the sill in the lobby, and I
Yeah.
just started stomping it, like, "This
Mm.
is where I'm supposed to be. This is where I'm
Yes.
supposed to be. This is where my feet are to be planted. Like, blessings are gonna come from this." Like, I was claiming it right there. I loved it. I mean, Georgetown, it had its challenges, I think, like every institution does, but
Mhm.
it still was a good home, a good place for memories, and yeah, I'm forever grateful for the Georgetown experience. It was a community for
Mm.
sure.
I definitely agree with that. It certainly was life-changing, I know for me. And what advice would you tell that young woman that was stamping that knowledge that I'm going to Georgetown, I'm going to be a physician? What advice would you say to her?
It really is about knowing that it's bigger than you, like, I can't even explain to you why that was my response when seeing that seal, but it's just you're there to do big things, and sometimes you can look around and you can see, wow, a lot of the people don't look it like me or whatever, and it can be intimidating because medical school in and of itself is intimidating, and then when you see that, the intimidation grows, but then you know what? They weren't the little girl growing up in Athens, Alabama, pig farming, knowing that she's gonna make a specific contribution for somebody that needs to see her. So I would just say when the intimidation starts to grow, you remember where you came from. And that's what our grandparents like to tell us anyway, but when you're standing on their shoulders, you're like, "Oh, I am where I need to be, and I have the reinforcements that I need to make it through this."
That's great advice. Along those lines, can you tell us, like, what at this moment in time and reflecting back on that experience, what you wish you had known? Maybe a piece of advice or a knowledge that you wish you had known prior to entering medical school.
I think I was shocked when I got to medical school, and for example, some people, they were like music majors and things like that in medical school, or they had some other kind of degree. They always had a plan B. I didn't know to have a plan B. I think a lot of times you think, oh, if I have a plan B, then that means I'm setting myself up not to achieve plan A. Where it was for them, they had options. That's really, I think, how you have to look at it, because I majored in biology because I wanted to go to medical school.
Mhm.
I didn't actually want a career in biology, but I thought that's the path that I needed to go to medical school. So I hate that I didn't know that part of it, to give yourself options. And I think now as you grow, you always think, well, you have to diversify, whether it's diversify your income, diversify this, that, and the other. That's one other area to diversify yourself in. It's like making sure you have options, even if it only like supplements your medical career. Have something that will do that. I didn't know to do that. So that's the advice I would teach people.
And that it is the sagest of sage advice, and I think everyone here, can speak to your same experience. And I just literally yesterday had a conversation with a mentee, And she asked me some, really good questions, actually, in terms of what my Georgetown experience was, but in terms of what I wish I had known. And that is so true to, I would even go a step further in terms of a B and a C. Just knowing your options is powerful, because when you, doesn't mean that you're not going to, for me, deliver babies for the rest of my life. I could, but at least if I knew going into it, if you know going into it that I can do other things, then you may be paving your path a little bit differently along the way, so you know that there are options. So knowing our options, that's a good theme.
But
Absolutely.
what I would also just like to add is, when I think about, I'm the first physician in my family.
Mhm.
And when my mother dropped me off on Reservoir Road to go to Georgetown, my first and only option was to graduate and become a successful physician. So there wasn't this sort of conversation about, oh, well, you can be an entrepreneur, or maybe there are careers that you can work on Wall Street and also have an MD. Or maybe let's think about going to business school so that you can get some other tools in your tool set. So I think that first generation physicians, our worldview may be limited, perhaps, because
Mhm.
we're the first and we don't know what options that we have. But as certainly you're saying, Andrea and Angela, that's where mentorship comes into play. I would say that's where just paying attention to what your attendings are doing, especially the ones in the community or the ones that are doing things that pique your interest. But along those lines, Andrea, you did have a plan B, because you went to public health school during med school or somewhere around medical school. Could you kind of talk about why you went to public health school? I think it's one of the best things in the world, and we went to the same school. So certainly I think that that's the best, but that is
Johns
neither here nor
Hopkins.
there. Talk about your public health school experience, and why did you go to public health school?
Well, honestly, I feel like I'm blessed because I took that path. I didn't intend to take that path. And I will say once again, thank you to you, because you were an advocate for me ending up at Johns Hopkins. And I definitely appreciate that. But I was married at the time and really wanted to stay in the DC area, which gave me much fewer choices for matching for residency. So I was desperate to stay there, and again, trying to figure out the options. And then getting the master's of public health was an option for me. And at first, I never thought about it, but in my third year of medical school at Georgetown, I got to do an internship over at the American Academy of Pediatrics, and I got to see a pediatrician testify in front of Congress. And a light bulb went off, and I was like, "Oh, you can do that with an MD? Oh my goodness, you can actually affect thousands of lives at a time? Never saw that coming. That wasn't on in the playbook, or I didn't think it was." And all of a sudden, I was conflicted. I was like, "Now I'm glad I'm in medical school, but now I see something else that I really like." I don't know how to make that transition, and still didn't actually make the leap at that time in my head. But then when Match came up and I was like, "Oh, I have very few options and I'm really trying to stay." And then you had planted the seed actually about public health, and I was like, that's kind of like what that pediatrician was doing. That might be something. So, ended up going there, and again, I feel like I was blessed because I went right after medical school. I didn't go to residency right after medical school. I did my master's of public health in a year. So I did, the intensive year-long thing. Actually was pregnant with my son during that year.
Really? Oh,
Yes,
good.
yes.
Okay.
I had him on May 5th and I graduated on May 19th.
That's what I was
Oh,
saying,
wow.
graduation, wow.
Yes,
That's
yes.
kinda
So
perfect timing, and then you go into residency.
exactly, and then I went into residency after that, so I'm so glad for that experience because I did always say, "I'm not exactly sure how I'm gonna get there, but I do wanna do something on a population basis, and I feel like this is gonna help me get there." Don't know when or how I'll get to apply it, but something tells me I am going to get to apply it, so I did that, and it was really, really a good experience. There was a practical experience we had to do at the time where you basically take what you learn and how would you apply it to the community. And I remember my project was on the opportunistic HIV drug pricing.
Oh, wow.
And
That's
really,
even appropriate today.
it
Wonderful.
really
Absolutely.
is, and it just I mean, it opened up my eyes so much and just taught me to look at different perspectives where I think I was very tunnel vision even in the way that I was looking at medicine, but that taught me a different way to look, and I think just being in Hopkins, because, I mean, they've done prestigious research, but at the same time, they had to acknowledge when they didn't work with the community right, the
Because they're in
resentment that
East
was caused.
Baltimore, and that is a community that's traditionally been an African American community. Certainly, they have issues with poverty and just lots of
Mm,
social ills, shall we say.
mm.
Exactly. So that really added an element to my thinking. And when you know better, you do better. So
Yeah.
very happy for that experience.
Wow. So that's a perfect segue. All of these experience that you have gathered and kind of put into your tool belt eventually led you to your current position as a CMO of a major health organization. Tell us what just a thumbnail sketch of what that's like, because we're definitely in awe of you. And I see some of the things that you do public facing, but I would love for our audience to know what that is about.
Absolutely. So I've had a convoluted path for sure, but I'm so happy for the journey. And I would say the one constant is just having the North Star, and that really is to serve and to make sure that I treat others the way that I want to be treated. And so I am currently the chief medical officer at a health plan, but before that, I served as so I did private practice, but then I went from there to being the deputy commissioner for the Tennessee Department of Health. And from there, I got to start Tennessee's SCHIP program, State Children's Health Insurance Program. I got to start it from the ground and it's still standing today. So that's definitely a crowning achievement for me.
That's
And
huge.
that was
So let's just level set for our audience. That is supplying or allowing for healthcare or health insurance coverage for children within the state of Tennessee who meet, I would imagine, Medicaid requirements. Is that correct?
so it's a really interesting niche. So their parents make a little too much for them to be on Medicaid, but not enough
Hmm.
for them to be in
So
employer-sponsored
they're in the
coverage. So they
gap.
were falling
Okay.
through the crack. Yeah, so that's what S-CHIP fills in. And so had the opportunity. The governor, I actually was talking to him and he said, we were at a conference. And after the conference, he was like, I like your thinking. I was like, well, thank you. And he was like, how would you like to start Tennessee's S-CHIP program? I was
Wow.
like, oh, sure.
So,
Yeah.
Andrea, wait a minute. Let's back up. We just need a little more granularity around that. Were you presenting at a conference where you just happened to meet the governor? How were you in the same? How did you get yourself in the room with all the decision makers? Because I think that skill set is really important.
So, with my being deputy commissioner for the Tennessee Department of Health, we would interact with the governor on a pretty regular basis. But every year, there's a National Governors Association conference,
Mm.
and the governors each take two people, subject matter experts from their state. That particular year, it was going to be the subject was child health. So the governor asked if I would be one of his two subject matter experts to go
Got it.
to the conference. And so I went, and you sit with your governor, and then there are big breakout sessions, probably a third of the governors in each section. But Dr. Satcher, who was,
Yes.
Yes.
Morehouse
he
School of Medicine.
moderated our breakout session, and so he asked some questions, and, and it was so funny. People wouldn't believe this because the governor seemed so straight-faced, but he asked a question, and the governor was whispering in my ear, "You gonna say something? You gonna make Tennessee look good?" So I was feeling all the pressure or whatever, but, when I felt passionate about something and felt like I needed to respond, I did, and somebody kinda challenged me, and then I went back at them. And after it was over, the governor and Dr. Satcher were talking, and Dr. Satcher said, "You got a good woman working for you right there." And he said, "I know that, and I found that out more today." And then after that, that's when he said, "Will you start the S-chip program for Tennessee?"
That's awesome. Wow.
And that's how that
That is
happened.
awesome.
Yeah.
So you had the moxie,
Mhm.
but you also had the knowledge and the wherewithal to push back or at least push forward your ideas. But also it sounds like you're just kind of living in your purpose though, because of your desire to help the overall health and welfare of the children of your state. So it just all came together. That is amazing.
It all came together. And I mean, it really is just, it is the drive that I have. I think it's that inner calling that allows me to speak up when I speak up. I'm not the type of person that likes to talk just to hear myself talk. I've never been that type person at all. But I think when there's something to say, you have to speak up, because you represent so many more people than yourself. So I just found myself in that spot where, it's like, this is my time. This is my opportunity. I am here with governors from all across the nation. Like, this is my time. And so I'm thankful for the faith that got me to open my mouth. And I'm definitely thankful for the faith that sustains me every single day. So I think I've probably gotten so far away from your asking what is a typical day in the CMO life like, but all that to say is when I started the S-chip program, Blue Cross was the health plan that was the benefit manager for that program. So that's how I met the Blue Cross people. And so as my governor was winding up his term, I reached out to them and just said, "Hey, I'm looking for what's next because I know the political world can change." And they invited me to come over with them. I knew who they were through that experience. They were the only health plan that actually bid on that business because it was new, no experience with it in the state. So I respected that. And everybody doesn't know this, and it varies from health plan to health plan, but we're a not for profit health plan, which lets the plan be more mission oriented. So I like that as well. But I don't think there is a typical day. Like, it's so different. I mean, from some days, just making sure operations are going well. Probably one of the more rewarding parts of it is when we're able to hold somebody's hand and walk them through the process to getting what they need. I love that part of it. To interacting with other stakeholders, that's another fun part of it. But there is no typical day.
That is a lot to unpack, and we appreciate the insight because, not many of us have done that. Not many women, for that matter, have been at the seats that you have sat at or the podiums that you have spoken at. So we appreciate you forging the way. I certainly appreciate your intentionality in all that you do because I do watch you and see you and know that your overall mission is for the health of patients. So I love that. Can you give us some advice to maybe an early career physician who wants to explore opportunities outside of clinical practice, such as some of the things that you've done?
I think if you see somebody at a conference and you're thinking, I never knew a physician would be involved in that or could do that, truly just ask the questions. I mean, that's always amazing to me, and everybody has an interesting story for sure. And then I think even asking the people, why have you stayed where you did? I think it's interesting the answers that you get. I mean, I think you'll get, depending on where they started or, if they had someone else in their family and they're kind of building from that. But why, for the folks that stay in practice, I think it's important to know their why, because I know it's not an easy thing to do. But I love all the time, every time I discover somebody that has an MD behind their name and they're in a space that I didn't imagine before. It's just, what was your story? How did you get there? Never, never forget to just ask that question. And I think if there's something you can dream of, I mean, there is always a first in everything. So if there's something where you think you can lend your talent, your education, it's okay to step up and say, can I fit in here? I mean, I think people would welcome that, actually.
So, Andrea, you're a healthcare leader. Could you talk about what leadership qualities are important for you?
Integrity and fairness. One of the things that I have truly learned is everybody's not going to like you. Like, we know that, but I think you feel that the more and more you're in leadership. Not everybody's going to like you. It doesn't matter what you do, how hard you try. Not everybody's going to like you. But at the end of the day, if people can say, I believe her to be honest, I believe her to be fair, like they even know that response is coming before I open my mouth. That's what I want them to know. And I always tell people, like, even if my words don't come together, listen to my melody. And that's because I try to let you know who I am by my actions. I may not always say it right, but you know who I am and you know where I'm going to stand. And at the end of the day, it's going to be on fairness.
Love that answer. I don't remember the song, but I do know the lyrics.
Yes.
Yes.
Donny Hathaway.
Donnie, oh, I should have known. Oh, I listened to him over and over again in residency. I can't tell you how many times. Yeah, great messenger there.
Yes.
So I have another, I guess, thing I'd like to know. In given the roles that you've held in practice now, public sector and private sector, what are some of the lessons you've learned, and where do you see there being opportunity?
I'll say every time I was in an arena, I always guess I wanted to see the best of it. So you're in a certain arena and you go, we always get it right. What are they doing out there? When it goes wrong, it must be them. And then I move over to another arena, like in the public sector, where we're trying to move the whole health of the state. And you're thinking, well, they're getting it wrong, because if they just were on the same page with us, then we'd make a dent in this. And you move over to the private sector and you're like, uh-oh, I didn't understand that perspective until I got over here. And so I think the thing that I've learned from all of that is it is a healthcare system. If we fixate on only one part of it, we never will make the system better. And it's easy to point fingers when you're in one particular segment. And I think that's not how it should work. I think that was one of the things that we did learn during the COVID pandemic, because more stakeholders came to the table on certain things. And we were able to make changes pretty quickly because we were all united for a mission. And so I just encourage people to make sure that what you're saying is informed, because I promise you, when you get perspective from another sector, if you're really open-minded and you get that perspective, you're like, oh, now I see why they do this. Oh, I see the motivation behind this or whatever. So again, I'm in the health plan side of things, but we represent a lot of employer groups. So we have the employer groups in our ears like, well, I want to offer benefits, but I also want to maintain my business. How do I keep it affordable where I can do both? Like, if you don't understand that's part of the motivation, you'll always go, yeah, nope, they're the bad guys. They just don't want. but you've got to hear all the perspectives, and everybody has to come to the table and be willing to make concessions. Now, I will definitely say there's opportunities on our side. I mean, you have to listen to those things that you can improve upon and make the experience better. So never excusing just my sector and saying we got everything right. Again, that's been my experience to say, yeah, I'm not going to say that because I've seen it from all different perspectives. And I do know that we can work together, but we've all got to admit that there's got to be some compromise. But if we keep the people we're serving in the middle, we can get there. It's going to take time. It's super complicated for sure. But definitely be informed before we point to one piece of it.
I like the thought of being informed. And certainly when I think about social media now and how much health information, and I'm using air quotes, is present on social media. And I guess what I'm wondering is how do we A, listen more, and then B, how do we have a more informed, whether they're physicians who are leading in healthcare organizations, and how do we get that information out? And then also when we think about patients and how they're gathering their information, I really worry that coming out of the pandemic, where there seems to be a lot more distrust and perhaps misinformation, that we're going to have to work very hard on trying to build that trust in those relationships again. But I certainly am up for the fight.
Absolutely. I can't agree with you more. And I think we're going to start to see, I think there was a point in time where everybody could come together for the common good of the public. I mean, we eradicated some diseases just because we all coalesced around this is what's good for the greater good. And now I fear we're going to see some resurgence in disease because we've gotten away from coalescing around that greater good. But I'm hoping that what will come out of that is that people will take the step back to say, what am I standing on now? I mean, is it just based on the politics or what I'm hearing on social media? But when it starts hitting in your backyard, I think it starts getting very real and very different for people. So I don't want to see any tragedy come. That would not be what I'd wish for anybody. But I do hope we'll learn from some of the hard mistakes that we see.
So I want to take a little segue because your answer was an episode in and of itself. And I appreciate your candor. I think our healthcare system certainly has its flaws. And I know I'm not alone as a physician saying this, but I think part of the potential solution is being open, not closed-minded, as you said, and having an understanding of where other people are coming from. And unfortunately, we tend to take our sides early and hard and fast, dig our heels in, and then are not able to listen to anyone else speak in this arena. So let's move towards something that I think is actually relative to this whole conversation because ministry, spirituality, all of that has to do with, I think, how you approach life, what you hear, what you put out into the world. And you and your brother, I understand, wrote a book, When Ministry Meets Medicine, A Modern Motivational Journey for Holistic Wellness. And I would love to hear more about that. I know your faith means a lot to you. And just wondering, can medicine and ministry not only coincide, but maybe augment each other? I think you'd be a perfect person to speak to this.
I definitely believe that. So, I have believed it for a long time. But when the book came about, there was a situation brewing in our lives. So, my brother is a pastor, and he's definitely way more of a worrier than I am at any point. So, my dad had been to the doctor, and my brother lives really close to my parents within 15 minutes, and I lived further away. And my dad had been to the doctor, and it was his PCP. The PCP called him back after some just x-rays, and he was frantic and told my dad he needed to come in immediately. My brother went with him, and he put up the x-rays and basically was saying, it looks like you have cancer all over your body. And so he was freaked out, said, you're going to need to go see the specialist or whatever. My brother called me right away, and he said, hey, this is what the PCP said. I was like, okay, so who did he set you up with? And he's like, did you hear what I said? I was like, yeah. And I'm asking, what specialist are you about to go see? Well, why aren't you upset?
Mhm.
I was like, he said based on his read, it looks like, but he's referring to a specialist because he's saying this is not his expertise. He knows enough to know
Mhm.
there's an issue and totally respect that. But I would love for the specialist to weigh in.
Mhm.
And
How
he
about a
just
tissue diagnosis? Sorry. The doctor and me is like, we don't have any tissue. We don't know anything. But okay.
Well, and so, but my brother was like, but he said it's probably cancer that's all over his body. I was like,
No.
Yeah.
we hadn't gotten to the diagnosis though yet.
Mm-hmm.
Oh my gosh, he lost it. And so, when my dad did go to specialist, I went and the three of us went together. And it turns out, they did more imaging, more precise imaging, and it turns out he did have kidney cancer. They did not see it all over his body. I'm not sure what was lighting up in the x-ray, but my brother and I were having very frank conversations at that point, and he was like, why didn't you get excited? I was like, we did not have the diagnosis. I wanted to see what the diagnosis was. And he's like, well, that shouldn't have stopped you from praying. I said, you didn't ask me, did I pray?
Right.
I prayed, but I said I was praying that we would get answers as the next step, where you were already halfway fitting him in a suit. And I was like, and he was like, so we argued a lot. My dad was like, hey, look, I need you both right now. So, and I love to just mess with my brother. I was like, preacher, how about you do your job? And I do mine.
I'll do mine.
you know, so he was just telling me when cooler heads prevail, and I was saying, I don't really understand why you're mad at me. He said, I felt like you were dismissing me and being condescending. I was like, how? I just said I wanted us to get to the diagnosis to know what we're praying for. That's all I was saying. I didn't say dismiss your faith, that I wasn't taking it seriously. And I was like, I do believe that God can heal in many ways. And one of the ways that he can heal is through medicine. I just wanted to know what we were talking about. I did not want to lose it and not keep that perspective and hear what was being said to us. And so we just talked about it and talked about we wanted the same thing. So how do we come together to say these things really can augment each other? And it's okay to, even in that kind of instance, to have a different perspective, but
Sure.
figure out how we can work together. And my dad really needed both of us. And he knew who to come to for the different things or whatever. And I knew when to just kind of hold my tongue for my brother to have his moment. So both are
Yes.
valuable. But I think we talk all the time about being well in mind, body, and spirit. But then sometimes I think in the heat of the moment, we lose that perspective. And I don't want us to do that, because there can be synergy in the way we heal if we embrace both the ministry and the medicine.
Wow. That's a lot. So we always at the end talk about our pearls, but I got a lot from your perspective. One of the things that came up for me though is we say something, or what I say to a patient may be completely different than what the patient hears. And it is sometimes based on perspective. And so sometimes we have to, at least how I have practiced this, kind of step back and remember the capacity that that patient may have, their knowledge base, their background, and present things so that they can hear exactly what I'm trying to convey. Is there may be something here, but sometimes, unfortunately, when the word cancer comes up, that's all that you hear. Not there could
Exactly.
be, there might be, there's probably not, but if the cancer is involved, then sometimes that's the only thing that the patient goes away with. But what a great perspective, because clearly you had to work through it. It wasn't just like a one-time conversation. You guys had to work through the process, and I can completely side with you because, yeah, you don't know until you know. And so one person saying something, that's like, me telling a patient something, and I'm telling them, but you really need to see the oncologist or the breast surgeon because, they're going to look at it from a different perspective and look at everything. And anyway, and we appreciate that and love the book. So hopefully at the end, and we can put that in the show notes. I think that is a relevant topic for a lot of people, just dealing with medicine and diagnoses in general.
Thank you.
So how has being a parent changed you?
Man, it's really been interesting. So my son is a young man at this point. He's 25 and he lives in St. Louis and he is in the animation business. So I love it. We talk every day and I love talking to him because it's so different from what I do. And I get so excited. And he had said to me at one point, he loves what he does as well. But when he first went to college, he was gonna be pre-med, and I kept saying, "I don't think that is what you want. I know you, I know this journey. I don't think that's you." And I was like, "Is that what you want 1,000%? Not even 100. Is that what you want 1,000%? Oh, mama, yeah, I gotta do it. I gotta do it."
Okay.
He was so depressed. And he called me from college one day and I was like, he's on the verge of breaking. I was like, what is going on? He was like, I hate pre-med. I was like, okay. And so advised him how to change. Anyway, he became an English major and now he is in the animation world. So they do they're like a subcontractor for like Hulu, Disney, all of those entities. So hopefully something will be in the theater this summer. That's the goal. So I do love
Awesome.
talking to him and it's great. And one of the things that he said to me one time early on, he's been in it about 2 years now, and he said, I don't get to make the impact on the world you do. I was like, whoa, whoa, don't you ever say that again. You do. You make the impact you're supposed to make. You tell stories. And a lot of times people will get inspirational to learn from the stories. I know it's animation, but still, people get something from that. And I was like, you're the best part of my day every day. I get to decompress from my world to hear what's
Absolutely.
going on in your world. And you make me happy with that. You just make me so happy. And just imagine what your stories are going to do.
Yeah.
And so now
Sometimes
he'll
that's
never.
therapy, right?
Yes, yes, I absolutely love it. And then they were approached not long ago, a really big company in the US and actually a global company that asked them if they could do a short and it was on health.
Oh.
And
Oh,
he was like, I'm gonna get to do it. I was like, see, you just walk in your calling. Like the moments come that
Your
you can
call.
make a difference to the masses. So he makes me proud. His career makes me proud. And we're getting to the point now and we still laugh about it. I tell him, and he'll say this too, I'm a friendly parent, because growing up, I was a parent. We were not going to be friends first.
Mm.
Now I'm a friendly parent. I'm still
You weren't
parent.
one of his little friends?
Yes, but we can be friendly. And so I enjoy the relationship. So he's here almost every other weekend and we hang out, but we enjoy hanging out. He is my pride and joy for sure.
That's beautiful.
If
I
I
love
had it to
that.
do over again, I would have been an English major, and done all my pre-med stuff. But yeah, so you don't have to go to be a science major to go to medical school, and definitely following your heart is really
Yes.
important.
Yes.
Agreed.
Yes.
Agreed. Well, Andrea, you definitely supported us just by honoring us by being a guest on our show. Can't thank you enough. Knew this would be great. How do you think we as women can support each other maybe better?
Man, I mean, there's a lot going on, and I'll just say since we're all in the health field where people are asking every other day, do you feel like this may change or that may change, in the field of medicine and all. And, you know, I have thought about that and sometimes, trying to anticipate and it just leads to some anxiety, to be honest with you. But at the end of the day, we're gonna still keep doing what we do, and that is to care for people. Like, that doesn't stop. I mean, that really doesn't stop. So I think we have to remember that there's so much power in our community, and that's not dictated from a federal level. So we have that power, and we continue to operate in that power and keep doing what's right. And I think if we just even think about that, we're going to be more supportive of each other. We're going to network even more effectively because, I mean, women are the gatekeepers of health and other things as far as I'm concerned also. So, yeah, we're gonna keep doing what we do, and we're gonna network even better.
Yeah,
Yeah.
absolutely. That we need that at this moment. But just kind of shifting gears more to the personal, how do you practice self care? I may have heard that you ran a marathon or a half marathon recently,
Yes.
but what's your self care regime?
Yes, so that was my 14th half marathon.
14.
Wow.
Awesome.
14th. Yes, every time I say it's gonna be my last one, so it may or may not have been my last one, I'm not sure. So that's one of the things I do, and honestly, like, I listen to inspirational music when I run, so that's helpful to just
Mm.
put everything aside and just
Is there
run.
something you have on repeat now?
What's very interesting, and I have tried all genres of music when I run, and everything. I honestly thought the hard rap beat was gonna be, what kept me on cadence, but it's actually the Christian music that I love the most because whenever I am about ready to give up in that run, that's when something that will pop up to say, keep
Mm.
going. And so it's just I have a long playlist, so not one particular thing, but that's the music that I like to listen to the most. Let's see, other things I like to travel. Travel is good. Although I'm a short traveler though, even if I go international, like 5 days is good. I'm
That's
ready to
good.
come home. Like, but I love it. I just pack the most into my trip. So I like to travel a lot and I like to read. I like to read all kinds of stuff. I love
Mhm.
mysteries. Those are fun for me.
Very nice. Well, a good regimen to end on reading and just can't thank you enough for being here. Anything else that I feel like we've touched on all topics of life today. Anything else that you'd like to share with our audience?
No, I mean, I hope people do tune in. I know I love what you all are bringing to the table, and I feel like I still learn from everything that you bring to the table. So, I mean, I'm truly just honored and can't wait to see what comes next for you all.
Oh,
Well,
very sweet and
Andrea,
kind.
thank you. Thank you.
Appreciate you.
Thank you. Thank you for sharing your journey with us today on Boss Sleep.
And Andrea, where can our listeners follow you or find you on either social media or online?
Really, LinkedIn is probably the best avenue. We tend to post a lot there, and there's certainly ways to contact me through LinkedIn. So I would say that's the best avenue.
Awesome. Very good. Well, thank you so much. We appreciate your time. I know it's precious. And for you and to our audience, until we meet again, may you be well.
Thank you.
So many pearls from our conversation with Dr. Andrea Willis. I'm just overwhelmed with just all of the things that she has accomplished and will continue to accomplish and really contribute to medicine, both
Mhm.
private sector, public sector. Dr. Willis is absolutely fantastic. What pearls did you take home?
I think one of the biggest pearls is the fact that she has an amazing story, right? This is what we're doing this podcast for, is just everybody's story is different, but how many people are you going to find that started off as a young pig farmer, you know? And I love the part that came out of that is, she didn't grow up to be a pig farmer, but she learned the value of hard work. And
Mhm.
so when I've gone through some of our podcasts before, I don't know that I have emphasized that part of, following your dream big, follow your own path. But I think the other part of the equation is no matter what you decide to do, you still have to follow that up with hard work. And I think that's
I think it's
valuable.
been implicit in our conversations, but yes, I
Well,
agree.
good. I hope so, but, I do I'm always thinking about the younger person that's listening to this, and I think, it's valuable to know that even though you may have this wonderful dream, it's still the hard work behind it that you see that not only goes into, getting to a place, but staying in that place and moving forward.
Is
So
it no
hard work.
faith without work? Without
Yeah,
works, right?
means
Okay.
nothing. That's right. Yeah, you got it, you got it. Yes, that's right. Again, I have to go back to our beginning because I know that when we, stop the recording today, that I will be listening to all of Donny Hathaway's greatest hits. Um,
Absolutely.
yeah, but listen to my melody or listen to the melody. I think just the lyrics, and for me, I'm taking is, to really kind of walk in your calling, do the things that you know you're called to do, and the things that you tend to worry about, and I'll speak for myself, that I tend to worry about tend to fall in place when I'm walking in my calling. And so I have to remember that. And I think those are the two major players for me today. But there was so much to unpack in that episode. So I'm very grateful for all that she had to say. How about you, Sylvia?
Absolutely, and I think when you talk about walking in your calling, life becomes easier if we're doing the things that we are called to do.
Hmm.
I didn't say life was easy. I
Hmm.
said becomes easier because it becomes, for me personally, a lot less full of effort. So I always talk about effortlessness. And I
Yes.
think that is that being that in that allowing space and being in the place I'm supposed to be here. I'm doing what I am called to do. I'm putting in the work and leading with integrity and fairness.
Yeah.
So she,
Yeah, that was
Dr.
beautiful.
Andrea, talked
Yes.
about so many things that I think are applicable wherever you are in your stage of your career, because you want to think about, are you putting in the appropriate work? We all have
Yeah.
work to do wherever we are. We want to make sure that we are working with integrity and fairness
Mm.
and power in community, I think is the last thing that she really left us with. And in these times, sometimes we are trying to figure out, well, what's the next move? And
Mhm.
I think one of the things that we need to really try and lean into is the power of community. So we're all in
Absolutely.
this place of not sure what's happening or how things are going to shake out. We do know from a healthcare perspective, we will continue to take care of patients,
That's right.
but we need to work with each other in the betterment of the community.
I couldn't have said it any better. Thank you so much. I appreciate your words. I appreciate your sisterhood, your friendship, and for, doing this thing called Boss Sleep with me.
I know. Wouldn't
And
want to do it with anybody else.
and I hope that for our listeners, that you feel like that you were in the right place today, and that the melody was good for you. And for all of those, we want you to continue to take good care of yourselves. And until we meet again, may you be well.
May you be well.
That's a wrap on another episode of Boss Leap. May this conversation enlighten your path toward personal growth and professional empowerment. For more thought-provoking and eye-opening discussions like this one, head to our website at bossleappodcast.com. Always remember to celebrate your wins and trust yourself. A positive mindset can push you out of your comfort zone and into far greater heights. Until next time, may you be well.
Before we go, there's one more thing the lawyers have asked us to include. You know, it's the legal language, and you know how doctors love lawyers. This podcast is presented only for educational and entertainment purposes. Although we are doctors, on this show, we are just your friends. This podcast is not intended as a substitute for the advice of your physician, professional coach, psychotherapist, or other qualified professionals. Understood? Awesome. We'll see you in the next episode.